Welcome to today's webinar presented by SuperCoder.com. SuperCoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Positions there. So I have a heart for family practice. In fact, right now, one of the best parts of the job that I do is teaching family practice residents in coding and documentation. So I've looked through all of the changes, and I tried to pull out the things that were going to be most important to family practice. Okay? Start with the ICD-9 changes on slide number 3. First of all, you just got your last regular ICD-9 update. Wasn't that exciting? You've got those new codes. Next year, we're only going to have limited updates to ICD-9 just to capture new technology. We're going to call them emergency coding updates. And Kim, what are emergency coding updates? And it's a case of where we have a new disease or a new condition that we need to identify statistically, and we can't wait for a regular update. For example, a couple of years ago when we had the H1N1 outbreak, we got a new code mid-year, and that will be the kind of code we'd get next year. Be very few of them, just the ones we need for emergency coding situations. October 1st of 2013, you probably have that deadline red and bolded on your calendar. That's when we'll go live with ICD-10. There would also be no new updates at that point, and at that point, ICD-9 updates cease altogether. There will be no updates at all made to ICD-9. And then in October 1st, 2014, we will start with our regular updates to ICD-10. So what do we need to do in the meantime? There are all sorts of training and seminars out there. What I'm urging you to do is get better at ICD-9. I'm going to give you a couple of hints and tips as we look through our ICD-9 code changes for this year. But realize that, yes, that code that we get is going to look different. It's going to have letters and numbers and a little bit different format. But the process of getting to that code is going to be the same. The looking it up in the book, the comparing the guidelines, that's going to be the same whether it's ICD-9 or ICD-10. And that way you can get better at it and be more prepared for ICD-10. Okay. Slide number 4, just throwing out, we have new E.Coli codes for very specific types of E.Coli. Now, your physician may not see a lot of this, and he may not have this information because this is going to be from the culture, but we've got the new codes for that. On slide number 5, I do think your physicians may have more of this when we're looking at maybe doing some excisions in the office, and I found this interesting, and through some personal experience, up until this year, we had the same code for a skin cancer no matter what type of cancer it was. And I didn't really think anything about it until my mom was diagnosed with a skin cancer on her nose. Well, they first said it was a basal cell carcinoma, and then they came back and said it was squamous cell. Well, that would make a big difference in her treatment. A basal cell is not likely to invade. It's not going to go really much further than it is. It's very, very little chance of spreading or of recurrence. Whereas a squamous cell has a much higher chance of growth, a much higher chance of spreading to the lymph nodes and other structures. So these are very different conditions, and we were coding them the same prior to our updates this year. And this is information that you're going to have when you do that excision in the office and you get that path report back. And I'll just throw this plug out there. Coming in January, we're going to be doing a audio conference in this format for family practice and other primary care offices to help them code and document their minor procedures in the office. So I'll throw that out there. But this is going to help you to show that was a sicker patient. Remember, that's what ICD-9 is all about, is showing our sicker patients. On slide number 6, we have a new code for dementia. Now, I know that this is something you're seeing in family practice. We've talked about this with some colleagues, and whether we have more patients with dementia these days or whether we're just
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at SuperCoder.com for a 7-day free trial.